Kia ora no tātou, ngā hui mai nei tēnei rā, ngā rauranga tira mao te mutu, ngā karangaranga maha. Mā ku a hau mō te Hiringa Mahara, nau mai hara mai, ki a koe ki tēnei ipurangi. Me mihi ki a koe mō tō hihia ki te kaupapa rongo nui, te ripawata o kaupapa Māori Services. No reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Just extending warmest greetings to you all, and may I, on behalf of Te Huringa Mahara, welcome you all to this webinar, and to thank you for your interest in today's topic, our report on the kaupapa Māori Services. A little bit of whakawhanaungatanga, tēnā mātou I te whānau o Te Huringa Mahara, e tuku atu nei kia koutou, ki tīmata ahau, I te tuatahi, he uri au o te iwi o Ngāti Parau, ko Kai Baker tōku ingoa. He mahi au he Kaitohutohu Wheako Māori, Principal Advisor Māori Whānau, lived experience, nō reira, kia ora no tātou, kia koe te rākau, Henry.
Tēnā koe, tēnā koutou katoa, ko Henari Hiko tōku ingoa, he uri ahau no Ngāti Kahununu ki te Wairua me te whakatohia. Ko au te Kaitohutohu tumuaki Hauora Māori, Principal Advisor Māori Health for Te Huringa Mahara. Kia ora.
Ko Kaitohu te iwi, ko Kati Hurirapa te hapu, ko ara whenua te Maraea, ko Hannah Park toko ingoa. I'm a policy analyst here at Te Huringa Mahara, and welcome everybody to our webinar today. And I'll hand to Katie.
Tēnā koutou, no kotarana oku te puna, I te pu mai au ki o te poti, he mihi tēnei ki te iwi mana whenua a Kaitohu, mō o rātou manaakitanga, he Kaitohutohu mātā mua o Te Huringa Mahara, ko Katie Chef toko ingoa. Kia ora, I'll be sitting in the background monitoring the chat and letting people into the webinar. If you have any comments or questions, please put them in the chat. We have turned participants' microphones and cameras off, so your computers are working just fine. So yeah, please reach out in the chat if you want anything at all. Kia ora.
Kia ora, Katie. Tēnā koutou katoa. He mihi ki tā tātou kaituku karakia, tēnā koe te tūnāne kai. Ko te reo karana tēnei o Te Hiringa Mahara, e tautoko ana te mihi kia koutou kua rau I ka mai nei ki tēnei huihuina. Ko koutou ngā kaihoe o te waka Hauora, e whakarewa ana I tō tātou waka ki te pai ora. Nau mai, whakatau mai, e ngā reo, e ngā mana, e ngā iwi, whānui o Aotearoa, tēnā koutou. He uri tēnei nā tūhoi pōtiki no te waimana kāku, te hapu take o Ngāti Rere, ko au te Kaitohu Hauora Māori mo Te Hiringa Mahara. Kia ora, ko Maraea Johns tōku ingoa. Hi everybody, I'm Maraea, the Director of Māori Health in Te Hiringa Mahara. Let's start with a very brief outline of our information about our mahi. I acknowledge some of you may have already heard this already in our previous webinars. So aroha mai, if it's a Groundhog Day experience for you. Kia manawa nui. And for those who are first-time attendees to the series of our webinars, it's information to fill your kete e huama. Fabulous and exciting. So let's kōrero about our role and focus. This slide highlights 6 key elements of the mahi Te Huringa Mahara does. Collectively, all these elements support and strengthen the efforts in our service to the people. The kaupapa is ultimately to have better and more equitable mental health and wellbeing outcomes for all whānau of Aotearoa. Te Hiringa Mahara was established in February 2021 as an independent Crown entity. We have a really important role, whānau, to monitor and report publicly on the state of New Zealand's Aotearoa mental health and addiction system, but also to advocate for improvements to the system. In particular, we advocate for the collective interests of people with lived experience and whānau who support them. We take a bit of a whāriki interweaving approach to our engagement, assessment, monitoring, reporting and advocacy in order to use all our taonga, our tools to influence and affect the change, the really, really necessary change. For example, we couple all our monitoring reporting with recommendations or calls to action and advocate for change. Te titio waitangi is embedded in our legislation and to being an organisation grounded in Te Tuti o Waitangi. We might not get it right all the time, and when we don't, we own our failings. We fix them, we learn from them, and then we move on. This slide is around our conceptual framework, He Ara Āwhina. He Ara Āwhina, or Pathways to Support, is a conceptual monitoring framework we developed to not simply describe the state of the mental health and addiction system, but rather use our monitoring findings to influence action and affect change. So change that will contribute to those better and more equitable mental health outcomes I talked about previously. He Ara Āwhina was designed in collaboration with the people with lived experience of distress, addiction, or both, with Māori and the broader sector. We published our framework, He Ara Āwhina, in June 2022, and made the major key aim of this framework is to really amplify the most important voices. There's tangata Hauora and Whānau as leaders of their own wellbeing and recovery, and the system responding to their needs and aspirations. So He Ara Āwhina illustrates what an ideal mental health and addiction system looks like from a te ao Māori perspective and also from a shared perspective. But using both of those perspectives, have 6 system aspirations that describe what good looks like for tangata Hauora and their whānau. They represent the important issues raised by communities during the mental health and addiction inquiry in 2018-19, as well as our development and engagement processes. This framework will be used to assess, to monitor, and advocate for improvements to Aotearoa's mental health and addiction system, and including all the services. Te Huringa Tuarua 2023. This is our second monitoring report, hence the name Te Huringa Tuarua 2023. We released it in May, featuring He Ara Āwhina for the very first time. So this report includes 3 key aspects. Firstly, a summary report which covered the breadth of monitoring across the mental health and addiction services, and it also explored what has changed in the mental health and addiction system over the past 5 years, so from 2017 to 2022, and it also looked at what else needs to improve. Secondly, 3 focus reports on key areas of the mental health and addiction system that we wanted to shine a light on, which are lived experiences of CCTOs, admission of young people to adult inpatient mental health services, and of course, kaupapa Māori services. And lastly, an online dashboard, which is currently being finalised as we speak. We have also released a separate report on the peer support workforce. This webinar is one of a series of webinars to present our Te Huringa Tuarua reporting. This webinar focuses on our kaupapa Māori services report. Ka hoa te au te rākau kōrero ina e nei ki taku tūnane, kia koe Guy. Passing the talking rights to my brother Guy. Kia ora Guy.
Kia ora Maraea. Our kaupapa Māori services report was released in June of this year. And we know that Māori have been advocating for equitable funding for kaupapa Māori service over many decades. Now, the purpose of this paper was to examine equity issues in the provision of kaupapa Māori and mental health and addiction services. In doing this, we adopted a dual methods approach by collating quantitative data, which came mainly from Manatū Hauora and Te Whatuora, and qualitative data, which was conducted through focus groups and an interview. We also established an internal steering group for Te Huringa 2023, and a small project group for this report, plus a Māori expert reference group, which had 8 external members. From this, we drew upon a Māori perspective on the current landscape of kaupapa Māori services and on what equitable services would look like. And we also gave an overview of the investment in and access to kaupapa Māori mental health and addiction services. The context for this paper is the higher prevalence of Māori mental health needs relative to other ethnic groups and the Crown's failure to address Māori health inequities. While the government has made commitments to address Māori health inequities, there have been shifts towards equity. Much more needs to be done. In our next couple of slides, we will see the voices of Māori. The voices of Māori are an integral part of this report, and it reflects people's current experiences, and this is what they said. Having a mental health and addiction system that understands, includes and protects mātauranga Māori is a critical enabler of improved Māori health and wellbeing outcomes. It is the Crown's responsibility to support mātauranga Māori and to enable mana motuhake and to protect it. During the 2018 government inquiry, Māori shared their concerns about how funding restrictions and contract configurations create a competitive rather than collaborative environment between Māori providers. We were told that contracts and funding still create barriers to what they can offer whānau in their communities today. The voices of Māori emphasised the need to be at the core of mental health service provision and reinforced that kaupapa Māori services should centre on whānau needs and aspirations, and whānau should direct, lead, make decisions on, and drive services. Our voices highlighted the need for healing outside of the biomedical model of care. They called for more holistic services that span the life course from the crib to the tomb for tangata whaiora and their whānau. Inequity between Māori and non-Māori causes lasting issues. What Māori called for in Hauora and in the Waitangi Tribunal Hauora report of 2019 was for legislation, policy and service provision to be consistent with Te Tiriti o Waitangi, with a focus on achieving equity. To support this, Māori also highlighted the need for high-quality data by ethnicity, monitoring of service delivery for Māori, with a focus on progress towards equity and a performance management framework that includes feedback mechanisms to inform continuous improvement. Tangata whaiora Māori were clear that if we were to see equity, society and the system need to change radically. Therefore, we must address institutionalised racism. We also heard that Māori want to see whānau as part of a meaningful Māori-Crown relationship at every level of decision-making, so that Māori may determine their own affairs in a way that aligns with their customs and values. Our He Ara Āwhina system monitoring framework, as Maraea described, shows what an ideal mental health and addiction system should look like and will be used to assess, monitor and advocate for improvements with the clear intention of amplifying those important voices, tangata whaiora and whānau, as leaders of their well-being and recovery. We now look at some of the quantitative data, and the next two slides show that over the past 5 years since 2017, the investment in mental health and addiction services and in kaupapa Māori services had increased. However, considering that Māori represent 17% of the population and have a relatively high prevalence of mental distress, the annual proportion of total mental health and addiction spending going to kaupapa Māori services has remained at around 10 to 11%. Now, the prevalence data that we have is outdated, but it shows around 30% of all Māori will experience distress to a level categorised as a mental disorder, and there is some urgency for updated prevalence data to be commissioned. On the other hand, it is pleasing to see that government has committed 20% of the Access and Choice Programme investment to kaupapa Māori services, and Manatū Hauora expects the value of funded kaupapa Māori services to be 35.5 million by June 2024. In the Awa Associates Interim Evaluation Report that was commissioned by Manatū Hauora, they reported that commissioning frameworks were beginning to enable kaupapa Māori services to work in kaupapa Māori ways. However, challenges still exist and more needs to be done. In terms of access, Previously, there was an increase in the number of Māori seen in specialist mental health and addiction services. However, in 2021-22, the number of Māori accessing specialist mental health services markedly decreased, which was consistent for all people, and this may be associated with the COVID-19 pandemic. Māori accessing specialist mental health services in 2021-2022 was 49,000. Māori accessed primary mental health initiatives over the last 5 years. The number increased between 2019-20 and 2020-21 before decreasing again in 21-22. In this last year, 23,000 Māori accessed primary mental health initiatives, with a further 29,000 Māori referred to all access and choice program services. Now, the proportion of tangata whaiora Māori accessing Māori specialist mental health and addiction services has decreased over the last 5-year period from 30% in 2017-2018 year to 26% in the last financial year of 21-22. So I'll hand back to Maraea to tell us what changes we want to see.
Kia ora, Guy, ngā mihi. So acknowledging the value, recognising the importance, seeing the positive outcomes of Te Ao Māori ways of healing, of just being, and the real differences it can make for tangata whaiora and their whānau, then these are the changes we want and need to see. Increased investment in kaupapa Māori services, the modelling, the funding model, looking at how equitable that allocation of funding is for new investments in mental health and addictions in regards to kaupapa Māori services. We want to see the use of commissioning approaches that, this is my one I love the most, recognise mana motuhake and tino rangatiratanga and enable Māori providers to design and provide services appropriate to their communities. Māori know most about what Māori want, need, and how to deliver that. So, yeah, that's a real given for me. Priority also needs to be given to commissioning a comprehensive mental health and addiction prevalence survey. Our data is out of date in regards to that information, so it's long overdue. So those are some of the key changes that we want to see. In concluding comments, prior to handing over to Katie and to Henry, the voices of tangata whaiora Māori made it abundantly clear. Radical change is needed, e huama, radical change is needed. Nō reira, he mihi mai o no tēnei kia koutou katoa, I whakapau kaha nei ki te tautoko mai I tēnei hui, ka huri ki te wā whakawhiti whakaaro, whakawhiti pātai hoki.